recording will be made available at a later date. All the lines will remain muted, and if you have any questions, please post them in the chat and we will answer them at the end during our Q&A. So who are we? The ESRD Network of Texas is a non-for-profit organization incorporated in Texas and provides services on behalf of the Centers for Medicare and Medicaid Services to kidney patients and their providers since 1977. Our mission is to support equitable patient and family-centered quality dialysis and kidney transplant healthcare through the provision of patient services, education, quality improvement, and information management. I would like to introduce our Transplant Trailblazer and PAC member, Ivy Ruiz, who was diagnosed with end-stage renal disease in 2005 and is currently a kidney transplant recipient. She has devoted a lot of her time advocating for patients with kidney disease. Some of her achievements and work include patient representative in Austin, Texas, a sitting board member of the Texas Renal Coalition, a member of the Network Patient Advisory Committee, member of the National Patient and Family Engagement Learning and Action Network, member of American Association of Kidney Patients, and she is heavily involved in state and national legislation that affects the renal community. And at this time, I would like to thank Abby for joining us on the call. And is there anything you would like to add?
Hi, everyone. I just want to say, yes, I had I've had my second transplant in 2019. My first one was in 2012. So yes, I've had 2 transplants. I've been around the block.
Great. Thank you for joining us, Abby. We're so lucky to have you on this call with us today. And a transplant trailblazer is familiar with the ups and downs of kidney disease. They are transplant recipients who provide guidance and emotional support by sharing their transplant experience, which includes preparing for the wait list, staying active on the list, being ready for a transplant, and post-transplant expectation. They also are paired with someone receiving dialysis who is thinking about getting a kidney transplant. Transplant Trailblazers do not give medical advice, but are encouraged to share their firsthand experience with their dialysis peers. And some of the topics that we'll discuss today will be the different criteria to get on the kidney transplant wait list, the benefits of a transplant centers in Texas, along with the organ procurement organizations, otherwise known as OPOs, the allocation changes that are coming soon, and the self-referrals. And we also have a question for you all. What are your myths and fears when it comes to kidney transplant, and what is holding you back from starting your kidney transplant journey? Let us know in your chat, and we'll discuss this at the end of the presentation. And I will hand it over to Abby. And Abby, take it away.
Sure. I want to start off by talking about the different criteria. Scheduling an appointment for your evaluation at your nearest transplant hospital will help determine if you are a candidate for a kidney transplant. Most centers have an intake coordinator who will speak with you over the phone and start the process. Of course, your insurance companies will be contacted to see if they will cover the cost of the evaluation and transplant surgery at the center of your choice. The next step, of course, is the initial visit. You will meet with several people at the transplant center, and they will discuss the transplant process with you and review your physical, psychosocial, and financial needs. Again, each transplant center has its own guidelines and criteria for deciding if you are a good candidate for a kidney transplant. However, at every center, you can expect to have a medical and surgical history, where the transplant team will sit down with you and talk to you about your medical history carefully. You're going to be asked about any illnesses, surgeries, and treatments you've had in the past. You will also be asked about any family medical history. If any problems are found, they're going to be further looked at, and a doctor will talk to you. The physical exam consists, of course, of the transplant team, and they just want to make sure that you are healthy enough for a transplant surgery and that a transplant is the best choice for you. They will examine all of your major organs and, of course, body parts to make sure that you are emotionally prepared for the surgery and post-transplant care and for living with a new kidney. The transplant center will need to know your blood and tissue type. So a sample of your blood will be taken at that time. And they just want to make sure, of course, that you're a good match. And it just means that your body will less likely reject the donor's kidney. The blood test will also be used to check the function of your heart, kidney, liver, thyroid, and immune system. And you will also be checked for problems with blood sugar control, electrolyte balance. Special tests that will look for certain viruses will also be conducted. In my case, I, of course, went to North Austin Medical Center for my second transplant, which was a very different experience from my first experience at Methodist in San Antonio. The differences, of course, were San Antonio set up a whole day of tests where I was there the entire day to conduct every single one of these tests. Whereas North Austin Medical Center scheduled tests intermittently depending on what they felt I needed to test based on the blood work. They also scheduled a class, and the class was great. You got to learn every aspect of transplant, every detail about a potential donor, and they wanted to make sure you left there with the knowledge of what you were about to do. First, once you get the transplant, which is considered the treatment of choice for many people on dialysis, a kidney can be transplanted from anyone, from a relative, from an unrelated person, such as a spouse or a friend, or from a person who has died. Only one kidney, of course, is required for you to live. What, of course, are some of the benefits that you can see with a kidney or receiving a kidney transplant? Is no more dialysis. You would have more time to do what you enjoy. You would have less food and drink restrictions and a greater chance for a longer life. If you are interested in receiving a kidney from a friend or relative, you should call your nearest transplant hospital and ask about their living donor program. They can help you determine whether or not a family member or a friend is able to give you a kidney. And that takes us to the different transplant hospitals and the organ procurement centers. So as you can see by the map, we have different regions. And by federal law, not-for-profit organ procurement organizations, or OPOs for short, are the only organizations that can perform the life-saving mission of recovering donors or organs from deceased donors for transplantation. And because Texas is so large, the state is served by 3 OPOs. And those you can see are Life Gift, Southwest Transplant Alliance, and Texas Organ Sharing Alliance. The OPOs are divided into regions, and that's what the 3 different colors are there. And it allows for anyone to list at multiple transplant hospitals in different regions. And different regions serve different cities in Texas. So to effectively list at multiple transplant hospitals, you have to take a look at the cities you wish to list in and make sure they're not in the same region. Listing in 2 different regions may make waiting for a kidney shorter. For example, if you live in Austin, Texas, such as I do, if you can see there in the center, we're in the yellow region, the Texas Organ Sharing Alliance region. It wouldn't benefit you to also list at San Antonio, as these 2 cities are in the same region. Another example is Dallas, Texas. If you can see Dallas up there, If you live in Dallas, you could also list in Fort Worth, as these two cities are in different regions. I don't know if you can see that. Dallas is in the green region and Fort Worth is in the blue region. They're very close together. Some OPO waiting lists, of course, move more quickly than others based on organ availability. So the number of individuals, of course, on the waiting list and the transplant centers within that OPO. This just simply means that you may get a kidney faster. So let's say you want to call your nearest transplant hospital. Your nephrologist, your primary care physician, your dialysis social worker or nurse can refer you at any time for a transplant evaluation. However, you can also refer yourself to many of the transplant centers and give them a call to make an appointment. Since each transplant center has specific referral guidelines, you should call your nearest transplant hospital to schedule an appointment. And you can find a list of all of the transplant hospitals in Texas in the patient portal on the ESRD website. I think next, Danny is going to tell us about the changes in allocation.
Yes, thank you, Abby. Can you guys hear me okay?
Yes, we can hear you.
Okay, awesome. Thank you. So hello, everyone. This is Danny Anchia. I'm actually a dialysis nurse. I was a PCT for many years, and now I'm here at the network as the Quality Improvement Director. And it is an honor for me to be here and share with you guys, and also share the stage, if you will, with Abby, who is one of our patient advisory committee members here at the network. So welcome everyone. So let's talk a little bit about allocation. I know that allocation can be a little complicated at times, and I'll do my best to make it simple, and hopefully you can take home some good points from today's presentation. So starting with UNOS. UNOS is the United Network for Organ Sharing, and they are basically a private nonprofit organization that manages all the organ transplantation systems and in the US. And so what they do, they usually start by making a list of all the patients who are listed for the different organs. In this case, since we are talking about dialysis, it will be kidneys. Sometimes kidney pancreas can be done at the same time. But so basically, when a kidney becomes available, they do what's called an organ compatibility screening. They look at the waiting times of all the patients who are listed. They look at the donor and the recipient immune system and determine who is the best fit or the best match for that kidney to make sure that it's compatible. They also look at different things like, whether the patient is a pediatric patient, and if the patient is pediatric, they get some extra points, if you will, or priority. Also, patients who have had a transplant before, when they get relisted, they usually get pretty close to the top of the list too. And also they look at the distance. How far are you from the hospital? These are some of the things that they do. And this is basically a computerized system that matches the kidney with the candidates that will have the best possible outcome. And also, they do that because they want to ensure the longest term survival for that kidney and for that patient. I just want to emphasize and make sure if you get anything out of this, um, they make sure that they only look at medical and logistical factors. Again, they only look at medical and logistical factors such as distance, for example, and that's all they use for the criteria. They don't look at personal or social details like, someone with a celebrity status or income or insurance. Those things don't matter and they're not even part of the selection criteria. And that's why it's a computerized system that they use to make sure that everybody has the same access and the same opportunities to get a kidney based on their medical and their logistical factors. So that's really important. The other thing to know is that kidneys are usually good for 24 hours up to 36 hours in some cases. The surgeons really like to get those kidneys in place as soon as possible because they usually have better outcomes when you do it like that. It's a little more fresh, if you will. But at the end of the day, the surgeon makes that final call on whether the organ is good for transplant or not. These organs go through a lot of scrutiny and testing, and they have different levels. But right before, there's been cases where right before the surgery, if the surgeon is not comfortable with the way the organ looks or the functionality, they may call it off. And so at the end of the day, the surgeon is the professional, the medical professional, and he's going to make that determination. It rarely happens these days because the systems are great and the hospitals do an incredible job. And so that's part of the allocation too, the surgeon making that call. Now, like Avi mentioned, there are different OPOs, and that is part of the allocation system right now. And you have heard maybe that people can get listed in multiple locations, which is good and is great and is encouraged. But you have to understand that you have to do it in different OPOs too. Because, for example, like Avi mentioned, you can have one OPO is in Dallas, and if you go to Fort Worth, the next OPO is different. So, meaning that organs are available from two different pools in the DFW area. And what that means to you is if you list in all the hospitals you can in Dallas, you know, Methodist, Better, Medical City, you name it, but if they're all in Dallas, they are all pulling from the same pool of organs. So if there is one kidney that you are the best match, they're going to call you regardless of which hospital you listed in Dallas. Now, if there was a kidney in Fort Worth, they're not going to call you because you're not listed there. However, if you are listed in Fort Worth, you have access to a different OPO. So now there are two different pools of kidneys that you can pull from. So I think when you look at multiple listing, it's important to see where the three different OPOs are in Texas. And you can select hospitals from the three different OPOs. So now they're not looking at just one pool, but they're looking at three different pools of organs that might be a match for you. So you increasing your chances of getting an organ. I've also seen a lot of patients on our database who are listed in Texas, and they're actually from out of state. So all that to say that if you want to get listed in New York because they have a shorter list, for example, and I'm just saying that I don't know if they actually have a shorter list. I'm just giving you an example. But let's say that New York has a shorter list, and you want to get listed there. You can actually apply in a hospital there. You go through the process, and if they determine that you meet the criteria, they will get you on the list. The only thing is that if they call you, you got to be able and ready to travel and find a place to stay and all that. But so all that to say, you have the right and you can get listed in multiple places, multiple hospitals. The best thing to do is to select different OPOs, which Abby mentioned those, and you can go back and review this presentation. And we also have those listed on our website. Um, there is a flyer that shows the different OPOs and all the 20 plus different transplant centers that we have in Texas that you can apply for. There's also on our website a resource where you can see how long it will take for you to get listed in the different states and different regions of the country. So you can put your zip code and it will, or look at different zip codes, and it will give you an idea based on your blood type and other things about how long it will take for you to get listed. If you say, let's get listed in, Florida, for example, or in Texas. So there are different tools available through our website that you can find to learn more about how allocation works. Now, there are some changes coming. There are some policy changes coming to the allocation. And they were supposed to start in December 15, but they have been pushed back until sometime in January because they want to review some critical comments that were submitted. So now we're waiting until February 13, and then we will hear from UNOS and see what they decided to do. But basically, the new allocation system includes now a distance, primary distance. So what's going to happen is that kidney or kidney and pancreas is going to be offered to candidates listed at a transplant hospital within 250 miles. They're using nautical miles because apparently it represents a better approach when you look at the geography, and it accounts for, mountains and different kinds of roads and conditions. But what it comes down is to basically 287 miles, regular miles. So when somebody lives within that circle, that radius, and a transplant comes up, the closer you are to that center within that radius, the better chances you have to get that kidney. And so one of the things they're doing that is to make it more equitable because with the current allocation as it is now, sometimes, like I mentioned earlier, for example, you have one OPO in Dallas, one OPO in Fort Worth. Let's say these two patients live 50 miles away from each other. One lives in the Dallas OPO, the other one lives in the Fort Worth OPO, and a kidney comes up in Fort Worth. And even if the patient in Dallas was a better match than the patient in Fort Worth, the patient in Fort Worth will get that kidney because he is listed in the OPO in Fort Worth. Now, with this new 250 nautical miles allocation system, now it is a better match for that patient, and that other patient will be getting the kidney because he is a better match and he is within the 250 nautical miles, and they both are 15 miles away from the hospital. So the patient who is a better match is going to get that kidney. That ensures that the kidneys are going to the right candidate, more so, and that the longevity of that kidney and the outcomes are going to be even better. That also helps with some disparities when you start looking at minorities and things like that, traveling. If you are within that 250 miles, then if you are the best choice, then you will get that kidney. And I think it's a good thing. So we'll wait and see what happens after February 13. But if you have any questions about this, I am no expert by any means, but I'm happy to share what I know. And if I don't have an answer, I'll be happy to connect you with someone in your hospital where you're listed, or if you're not listed, I'm happy to make that connection for you to get listed and speak to a transplant coordinator who will be willing and able to answer any questions that you may have. So in addition to that, let's move on to the next slide. So referrals. Usually a nephrologist or someone at the facility will help you with the referral, and they are supposed to do that. They're supposed to guide you, your facility social worker or charge nurse or whoever is in charge of the transplant referrals in your facility has a duty to help you navigate through this process. But all that to say that you don't have to necessarily have a doctor's order or a referral in order for you to get evaluated for a transplant. You can actually refer yourself. You can go to any transplant center. You can contact them by phone, which is probably the easiest right now. Just call your transplant hospital that you're interested in. Tell them you're a dialysis patient, that you're interested in kidney, and you don't even have to be a dialysis patient. In fact, a lot of patients are actually getting kidneys before they even start dialysis. So that is another option, and that's called preemptive transplantation. But yes, you don't need a referral. You can do it yourself. You can select any hospital you want, and that is your right and your choice to do. So yeah, feel free to call your nearest transplant center. Let them know that you're interested in a transplant, or that someone in your family, for example, is interested in becoming a donor and they want to go through the process with you and see if you're a match. You can do all those things on your own. In fact, a lot of times it will expedite that process because you don't have to rely or wait on a middle person, if you will, to do that for you. The facility should release any documents that the transplant center will need in order to get you through the process. That's easy and simple, and then you can get listed. Another thing to take into account is if you have someone who wants to donate a kidney for you and they happen to not be a good match for you, you can always take advantage of the pair transplant or the exchange transplant option, which basically finds another donor who might be a match for those for you, and then you swap the kidneys and you end up getting a kidney. So having a donor is actually a great thing. Even if they're not a match, they're gonna find someone who is, and then they can swap the kidneys and you can still get that kidney faster. Having a living donor is the fastest way to actually get a transplant. So you can get on the transplant wait list, but you can also do some work on your end to try to get a donor to get a kidney faster. So other than that, I think that was the last slide that I have. I will bring it back to Orlandra, who will talk to us about the patient portal. Thank you, Avi, again. And if you have any questions at this point, please put those in the chat. We want to hear from you. We want this call to be interactive. We want to hear your thoughts. Doesn't necessarily have to be a question. Any thoughts, any comments, any ideas. If you are a patient and you want to consider transplant, awesome. Work with your facility, but we're also here to help. And if you also are a trailblazer or want to become a trailblazer and you have questions, let us know. Share your experiences, whatever you want to share in the chat. That's what we're here for. Let's make this call interactive and learn. Let's learn from each other. Arlandra?
Thank you, Danny, and thank you, Abby. Our patient portal was developed with resources and videos highlighting important healthcare topics such as transplant, dialysis at home, and COVID-19, and many more. The patient portal is not only for patients, but for caregivers and family members too. And we update it monthly with the newest available resources. So go check out the patient portal if you haven't yet. You can scan the QR code that you see on the screen, or you can go to our website and visit the patient portal. And like Danny mentioned, if you know someone that is interested, or if you are interested in becoming a Transplant Trailblazer, please let us know and we can get you started with that. And our contact information is here. So if you have any questions or comments, feel free to reach out to any of us and we will help anybody out. And this concludes the end of the presentation. So then we can look at the chat and see what questions we have. And I think I saw one that says, from a patient, I am in an active list for transplant because I tested positive for COVID. I am working to get back again. My biggest fear is COVID. Will I be more acceptable to COVID since my body immune system is down? Danny, do you want to answer that?
Sure. I think, thank you for the question. That's a very good question, and it's interesting. You know, there is a lot of unknowns about COVID. We're still learning about the disease, but we've seen that it is harder. Usually, once you get COVID once, it is harder that you will get it a second time. And there are some cases, though, where we're seeing patients getting reinfected, but building those antibodies from being exposed to COVID is going to help you you know, with COVID and not to get it again, hopefully, or if you get it, it shouldn't be as bad. But I think, you know, having a low immune system definitely is one of those risks, and that's one of the risks that usually are discussed with patients. And, you know, therefore, patients who are in dialysis, patients who have any type of chronic disease, patients who are actually transplant patients may be a little more susceptible to COVID, but not just COVID, other viruses and other diseases too. But I think that's something that you will be better off discussing with your transplant team, and they will be able to answer those questions. They do a pretty good job regulating your medications and your immunosuppressants. They monitor you very closely. They don't take any chances. And if you happen to be a dialysis patient or a kidney transplant recipient, and you think you're exposed to COVID or you end up getting COVID, uh, they will bring you in right away and they won't just play around, if you will. They will make sure that you are good and safe and give you all the medication that you need to keep you healthy. But I will say that don't let COVID keep you from getting listed and getting a transplant. because it's no different than being in a dialysis clinic. In fact, I think you are more exposed to or susceptible being around other people and other patients who you may not know where they're being or been exposed to than getting a transplant and being able to stay at home without having to worry about doing dialysis. So a transplant to me it's always the best choice, regardless of what the situation is. So hopefully that answered your question.
Okay, another comment from the question we asked was a lot of the patients don't want to be on the list is the cost of the transplant medication. It's expensive. Abby, do you have, or Danny, anything to add to that?
I'll let
Yeah.
Abby, yeah, I'll let Abby speak and then I'll pitch in.
So to speak on the medication, the fact is, if you are on Medicare, Medicare pays for the medication for the first 3 years. However, legislation was just passed, and we're still waiting for it to be signed, where if you get a transplant, medications will be paid for forever. And the reason they decided to do that was because it was more expensive for you to get a transplant. And then after 3 years, you wouldn't be able to afford the medication. It's kind of a waste of an organ to just cut you off after 3 years and then make you go right back onto dialysis. So the legislation will cover your medications potentially in perpetuity. So that's where we are with medications. Now, different insurance companies have different regulations on the transplant immunosuppressions. From what I understand, some of the insurance companies cover them or cover a portion, like an 80-20. They will cover 80%, you'll be responsible for 20%. Whereas Medicare pays for them for the first 3 years of your transplant. So it's just depending on what kind of insurance you have the time you get your transplant.
Very good, Abby. Yeah, I was going to mention the legislation that just passed, but you sound like you are on top of it.
On it.
Thank
I'm
you
right
for sharing
on
that.
top,
Yes,
right on
yes.
top of that, Rose.
That's awesome. Yeah, and you know, some hospitals they also have some hospitals, some programs have additional funds that sometimes they can use to help cover some of the expenses or some of the medications. So I will find it very rare that a hospital will let you lose your kidney because you can't pay for your medication.
Yeah.
There's a lot of funds, not just hospitals, but other organizations like, you know, Texas Kidney Foundation
KF.
or NKF, and
KF
there are
has it.
many resources out there that you can reach out to if you were in that situation.
Mhm.
And another question, I think Abby, you might be able to answer this one. Transplant failure. What are ways to prevent failure and help ensure success?
That is a hard question since my first transplant went into rejection. The best thing you can do is listen to your transplant staff. You have a whole team of not just nurses, you have dietitians, of course, your doctors. In my first transplant, I was doing pretty good. I wouldn't say I felt the best. And part of that was because I had what's known as virus. I don't want to scare anybody. It's just like a regular virus. But I ended up getting E. coli, and they had to give me antibiotics. And most of you may know antibiotics are really hard on your kidneys. But the best thing you can do is just take care of yourself. You know, wear your mask. We've been wearing masks forever when you go out into crowded places. Make sure you're just aware that you take your medications on time, because you do have to take medications on a schedule as they're time released. And those medications may change over time. They may say, well, you need to be on this medication now. So it's important that you listen to your doctors and start exercising, eat better food. You'll notice that you feel better and your kidney starts to work great. Like right now, my new kidney's working great. My creatinine is doing wonderful. I've lost weight. I notice I'm eating better, and so far is wonderful. Doctors are really happy with the performance. So my only advice to you is to just listen to your doctors and be aware of what's happening. Follow your labs, ask questions. make sure you ask the doctor, what can I do to improve this? And they will be happy to help you reach any goal that you want, including keeping your kidney.
Thank you, Abby. Another question. For patients who are not a U.S. citizen, but the patients have insurance, are these patients able to apply for transplant?
I wish we had a transplant coordinator here, but I heard that if they have legal status, they don't have to be necessarily a U.S. citizen, and if they have insurance, they can actually work with the hospital, and if the insurance is willing to pay for the transplant and everything related to it, then the status doesn't really matter. But that's a question that they have to check with the hospitals. I know that there are different policies, different internal policies that different transplant centers may have. But I've heard that it is possible if the insurance is willing to pay, and also not necessarily have to be a U.S. citizen. It can be someone, let's say, a work visa or a student visa or a permanent resident. There are many different types of statuses that are not necessarily don't necessarily make you a U.S. citizen, but give you a status enough to get a transplant. So
I've heard the
check with
same
your
thing. I've heard
yeah.
that most transplants, they feel that the need for the organ takes precedence over citizenship, and as long as they have insurance. But again, each hospital has different criteria, like Danny said.
Yeah. It may keep you from accessing federal programs, to help you for stuff, but if this person can find a way to pay for it, and if the insurance is willing to pay, I don't see an issue there. But again, just check with the hospital and make sure. And if you check with one hospital and they tell you no, you can't do it, go check with another one. I've seen situations where a patient gets denied for transplant in one hospital and they go to the next one and their criteria can be a little bit different and they get listed and get a transplant. So don't give up. Try different things and you always learn something new every time you ask.
Okay. Thank you, Danny and Abby. Another question in the chat is, what is the wait time in getting a kidney from the UNOS pool?
I guess I'll speak to that. Well, all the kidneys are coming from the UNOS pool. UNOS handles all the organs, including kidneys, obviously. But the waiting times vary depending on many different variables, depending on your blood type, depending on your antibodies, depending on, whether you're a first-time recipient or a second time or third time even. Also, depending on where you live, your zip code and your state, what OPO you are listed in. So it varies a lot. In Texas, average, I believe the last time I checked, it was about 7 years, Abby. Do you know? It's about 7 years in Texas if you are like an O positive, which is the most common blood type.
I read 3 to 5.
Okay. So yeah, it depends on a lot of things. So it will be at least a few years. I will say, yeah, three to 4 years before you get a transplant or called in, but up to 7 years, somewhere in between in Texas. However, like I mentioned earlier, if you have living donor, you bypass all that. The moment that living donor gets approved, you get a kidney. And Southwestern, for example, UT Southwestern, I think they did one in like 6 weeks. It was really fast, and even shorter than that. I've heard cases where if everything looks good, you can do the transplant right away, just within weeks.
Thank you, Danny and Abby. These are all great questions, everyone. Keep them coming. These are great. And I have one more for you, Abby. Someone's asked, has your BK virus come back with your second transplant?
The answer is no. Knocking on wood. I have not had any issues with any viruses, and it's been over a year.
That's awesome, Abby. That's so good.
Mm-hmm.
Very good.
I'd like to add another myth around transplant is age, that there is an age limit. And As far as age, each transplant hospital has different criteria, like we talked about earlier. But I know that the transplant hospitals that I went to expressed that there was no real age limit as long as the patient was healthy enough and met the criteria.
That's correct. I've seen patients in their 70s, mid 70s, get transplant and do very well. Just like I've seen patients in their 20s get a transplant and they don't do what they're supposed to do and they lose it.
Right.
So it is relative, and that's why the best way to find out is to go get evaluated. Even if for whatever reason, let's say your physician thinks that you may not be a good candidate, just give yourself the benefit of the doubt and let the transplant center look at you and make that final determination.
Another question, Danny, and this one is about the allocation. So candidates will be chosen within the 250 miles of the OPO.
That is the first level. So the patients who are the candidates who are within the 250 radius will get first choice. If for whatever reason there isn't a good match within the 250, then they go outside the 250 miles, and that will be the second level. So there are two levels to the allocation. Within 250 miles is level one, and those patients will have priority. If they can't find a match for any of the patients within the 250, then they go to the second level, which is the second priority list, and it's everybody else outside that radius. So you get first choice if you are within that 250 radius.
Another question, Danny. Why are we trying to get more people referred and on the list if there are not even enough kidneys? That's a two-part question. The second part is, why would it not be better for the patients who are the best candidates to be on the list?
Well, we want more people to get listed because we want more people off dialysis. And I think the reason there aren't enough kidneys available, if you will, is because there is a lack of awareness. And there's a lot of people who will be willing to donate if they really knew what everything entailed, but they don't know. And so we're working on that too. And a lot of organizations are working on that because the reality is that if all the people who actually said they want to be donors and even put it in the driver's license, if they were really, not that they're not serious, but if they really understood and were willing to do it and they knew of a place on how to actually donate that kidney if somebody became a good match, we wouldn't have that shortage. So that's something that we're working on. There's some legislation trying to make that system better. UNOS is working on that too. But the first step is to get listed. And I mean, even if there aren't enough kidneys, you may actually find a match that is the best for you, you know? And so you still have a good chance of getting a kidney. If you don't get listed, you have no chance. If you get on the list, even if there aren't enough kidneys, but you are a good match for the kidneys that are available, they're going to give it to you. So you're better off just being listed anyway and getting off dialysis. You know, transplant is one of those things that is going to give you the best outcome. Not a cure, but is the best modality to get your life back, to get off dialysis, to get, more control of your diet and all those things. It's gonna be the best outcomes for you as a chronic kidney patient. What was the second part of the question?
Why would it not be better for the patients who are the best candidates to be on the list?
I mean, there are going to be either you're a candidate or not. And once you're listed, like I said, it's not that one is better than the other one. It comes down to matching. Once you're a candidate, then the matching is what's going to determine who gets a kidney rather than the other person. But it's not that you're better than the other, or one person is a better candidate. Some are pretty straightforward. You see patients that are just like, yeah, like, you really don't have many health issues, and they get listed pretty quick. And so I guess that's what you will quote unquote considered a better candidate. But there are also patients that may have more comorbidities, but can still get listed and still benefit from a transplant. So when they do a match, they also look at those things. There are kidneys that may not be optimal for a 20-year-old person, but it might be a perfect match for a 72-year-old person. And so we need all types of candidates in that waiting list because we have different kinds of kidneys available. So rather than discarding a kidney because the patient is too young and they don't want a kidney from a 60-year-old, but that 60-year-old kidney can go into another candidate who's might be in their 70s and do very well and have a pretty decent quality of life for the rest of his life. So yeah, I will just recommend everyone get listed, and then the hospitals and units do a pretty good job determining which kidney is better for each patient, determining depending on their status.
Abby, I have a question for you. Is your transplant from a deceased or living donor?
It is from a deceased donor. Both of my transplants have been from deceased donors, solid organ.
Good. Another question, would ethnicity be part of the computation?
Ethnicity. I'm not sure, to be honest with you. I don't know if that's part of the computation or if it's in the system. I know it's there because they track all that, and I know that, for example, African Americans and Hispanics are more prominent to or more prone to have kidney disease. But so are diabetics and people with hypertension. So I don't think this is necessarily a deciding factor on whether you get the kidney or not. They look more at biological issues in terms of, your antibodies. If your body is going to reject that kidney because your antibody levels are too high, things like that. But I think ethnicity is not going to determine whether you get a kidney or not necessarily. It's in there, it's part of the information for that patient and it's tracked, but I don't think it will determine. If you're a good match, it doesn't matter what your ethnicity is. If you're the best match for that kidney, ethnicity doesn't really should make that much of a difference on whether you get it or not.
That looks like the end of the questions, but I actually have a question for Abby. Abby, to anybody that's on the call, what would you have liked to known before you started the entire transplant process that you didn't know? You wish that somebody would have told you?
I think for me, when I was on dialysis, I had no idea that I could be listed for a transplant. That was something that was a shock to me after 2 years being on dialysis. I was, shocked to hear, hey, why aren't you on the transplant list? I wish I had a lot more education in the beginning when I first started. There was a lot of education on my fistula. There was a lot of education on their diet restriction, but there was no push to get a transplant. And I wish that was something that had been done in the very impetus of my diagnosis.
Okay, and I look like you added some links in the chat for the Transplant Center in Texas and one more item as well.
I added the list of transplant centers in Texas, and I also added the scientific registry of transplant recipients for the person that was asking about ethnicity. This is data. This is raw data you can go and look up. You can look up transplant center's name, the location within miles, state, by pediatric or adult, and find out more about the number of transplants versus the number of organs that have been available in that location that you're looking for. And it's kind of a nice website to kind of take a look and see. You can go look up North Austin Medical Center and see how many transplants they did in 2019 versus 2020. It's just some fun data to look at.
Thank you, Avi, for sharing those. I wanted to add something to the question of ethnicity, because I also know that even though the organs are not matched by race or ethnicity, they usually, genetics are genetics, And for the most part, if there is a large pool of, let's say, African Americans, and is a large influx of kidneys coming from African Americans, chances are, because of genetics, you're gonna find a better match from that pool. So it has a little bit of effect on how well of a match you can be, if you will, but it doesn't necessarily determine who gets it or who doesn't. I don't know if that makes sense. But let's say, if there is a large number of donors within a certain racial group, then if you are within that certain racial group and there is a large number of donors, so your chances of getting a kidney go up because you have more kidneys to choose from. But that is not in the computation that UNOS uses to determine whether you are a match or not. So hopefully that makes a little bit of sense. I don't know if that makes sense, Orlando or Abby, but I just wanted to add that in there. Make sure that people understand that it doesn't matter what race you are, not going to determine, oh, this person is Hispanic, you're not getting a kidney because you're Hispanic. That doesn't mean anything. They don't use that to determine matching. They look at the antibodies, they look at genetics, they look at morbidity and how long you've been on the list and all that. And if you are a match, then you're a match.
That is true. It's about compatibility and not about necessarily race or ethnicity.
Correct. Yeah.
Thank you both. And it looks like that is all of the questions in the chat. Danny or Abby, do you have anything else you want to add before we conclude our call?
No, I would just like to encourage any patient who is considering it to seek out more information, reach out to the network, reach out to any of the Transplant Trailblazers, and get listed.
I agree, and I second Abby's recommendation, and I thank everyone for being here. And just to remind you that we will have this type of calls once a month, different presenters, different patients presenting and giving their perspective. So if you have any questions or if you feel like there are some topics or areas that you would like for us to address, then let us know and we will make our best to include those on our next presentation. It will actually help us come up with content for future presentations as we continue to have these monthly Trailblazer calls.
Thank you, Danny, and thank you so much, Abby, for being on our call today and sharing your perspective and your transplant journey with us and everyone on this call. And like Danny said, please let us know if you have any questions or comments. And the recording of this webinar will be posted at a later date. And thank you, everybody, for joining us, and have a good day.